Acne is among the most common dermatological consultations affecting people of all ages. It is a long-term skin condition that occurs when your hair follicles become clogged with oil, dead skin cells, or Propionibacterium acne, causing pimples to appear on the surface of the skin. Risk factors mainly include family history, obesity, and hormonal imbalance. It is aggravated by stress and smoking, fourfold aggravation due to daily milk intake, and sevenfold aggravation due to daily ice cream consumption. Pathophysiology starts with hyperseborrhea followed by hyperkeratinization, leading to the excess sebum accumulation inside the follicles and the formation of comedones. Retentional acne could progress into inflammatory acne upon the proliferation of Propionibacterium acne, ending up in follicular rupture. Different manifestations are possible. Follicular wall may bulge and produce white heads. The bulge may open to the surface, darken, causing black heads. Papules are the raised red spots with white center that develop when the follicle is inflamed or infected. Finally, the pustule containing pus. Let's just not forget to mention Cameron Diaz, the beautiful actress who shared her struggle with acne in her teen years and 20s in the book she wrote in 2014, The Body Book. Never pop your pimple, and thank you for watching.